Hi everyone, I'm Brad at Capital Caring with Care Navigation, and today I'm here to talk to you about the role as Care Navigator Specialist. You all know our mission here at Capital Caring is to simply improve care. We do that through learning and teaching every day, delivering complete customer satisfaction, developing leadership because we are only as good as the people in our organization, living within the model. That allows us to serve another decade to our communities and a decade after that, so we're still here, and inspire a culture of trust. So what is a Care Navigator Specialist? Care Navigator Specialist is a clinician or a non-clinician that is ready to answer calls coming from our patients into Capital Caring within 3 rings, 24 hours a day, 365 days a year. Care Navigator Specialists can be nurses, we can be social workers, doctors, nurse practitioners like myself, or non-licensed professionals. Care Navigators simply improve the care of patients by helping navigate the patient through solving requests efficiently, quickly, and safely. Some important points to remember for Care Navigator Specialist is don't let the technology that you have bog you down. You have a lot of technology. You have some big programs on your computer and your phone systems, right? Don't let that hinder your ability to give good patient care telephonically. Listen to the caller calmly. Your job is to keep those in crisis calm as best you and they can. Get them answers quickly. Improve care. Make it simple. Make it easy. Simply improve care for the patients, because we all know, every one of us here at Capital Caring know, our patients and their loved ones have enough to deal with. So how is this going to work? It begins by a phone call coming into Capital Caring, whether it's day or night, and that call must be answered, right? So, a non-nurse Care Navigator Specialist answers the phone in step 1. Then, the Care Navigator Specialist is told by the caller that their loved one is in a crisis. They are in pain, they are agitated, they need help. So therefore, because the person who's answering the phone, the Care Navigator Specialist, isn't a nurse, they need some help to handle this call. So immediately in step 3, the non-nurse Care Navigator Specialist tells the family, I am going to help you. I am going to connect you with a nurse to get you help. I'm going to place you on a brief hold, and I'll get back with you within 30 seconds. So that means every 30 seconds you're checking in with that caller, making sure that they are aware you are working hard to get somebody to get this resolved. Step 4. So the non-nurse Care Navigator Specialist must assign this caller to a nurse who's on duty. Now, the nurse is going to be working either in Care Navigation or outside of Care Navigation. So let's break that down a little bit. In Care Navigation, you have a system called Cisco, as you all know, and Cisco lists the nurses who are on duty with their credentials, and beside that, it indicates whether they are ready or not ready. And what that means is, are they ready to take a phone call, or are they not ready to take a phone call from you? If they're not ready, that means they're on the phone with another patient family or someone within the organization trying to solve an issue. So you can't call them to help you. You have to call somebody who's in the ready mode. Now, if you've looked all over for places to call, you're then going, and you haven't found anybody who's in the ready state, that means you need to go to the nurses who are working out in the field. That means the nurse who is either in Arlington or Merrifield or Alexandria, DC or Maryland, to get a hold of them to help you take the call. So, in step 5, the non-nurse care navigator makes certain when you find a nurse to take the call, that you connect the caller with the nurse on the other line. You make sure that connection happens. Do not just hang up. Make sure that there's a good connection between the nurse and the caller. So when the nurse gets the call, what's their job? What are they going to do? It's important that you know that. So for step 1, we go back to the basic of the non-clinician care navigator specialist, making certain that the RN and the patient or the loved one on the phone, the caller, has a good connection. Step 2, care navigator hangs up, leaving the RN, the nurse, with the patient and family dealing with the clinical need. Then the RN is going to assess the situation, get the patient demographics, the name, the phone number, the code status, the location, what team they're on. From all that data that they're collecting, they're going to decide what the issue is. Is the patient in severe pain? Does the patient need a visit? Does the patient need some help learning how to use a medication or a question about a medication? In step 5, the RN then decides firmly, how do I, as the nurse, intervene now? Do I have a nurse sent there to take care of the issue? Maybe I can take care of the issue by answering some questions on the phone. Many times people have called me and said, Brad, help me use this dropper in this bottle of morphine. Is it 0.5 milliliters or 0.5 milligrams? Can you help me understand that? And that's something I can help do over the phone. But sometimes that nurse is going to have to make a request for a visit. And that's when the nurse, as you can see in step 6, the nurse out in the field is going to communicate back to the nurse in charge in care navigation to get a nurse who is closest to that patient, who is in the same team, get to that patient to take care of them. So this is all under the term escalation, knowing when to escalate, because stressed people will call us. Patients or family call to get answers. They don't want to hear any barriers to their requests. When they're calling and they're stressed out, you get to decide how you're going to react. You have one chance to make the best impression and calm the situation down. Find them a calm and smart resolution. So let's define what you're going to hear a lot of, which is escalation. Escalation in our world in care navigation means that there's a problem you can't solve. That requires intervention by another professional, whether that be a nurse, a social worker, doctor, nurse practitioner, manager. So therefore, you have to move the call up the ladder to resolve the issue while remaining calm and efficient. So, listen calmly to the caller's issues. Let them know that you can help them. Let them know you're going to place them on a hold while you reach the appropriate discipline, and that you'll keep them updated if it takes more than 30 seconds. Never hang up on the caller. Stay with the patient. See the problem through, delivering complete customer satisfaction. Say this 10 times aloud. If I can't help them, escalate to someone who can. That's very important. If I can't help them, escalate to someone who can. And here is where we go on going up the ladder. Notes on escalation. It takes a village. Who can you escalate an issue to? When you as the non-clinician get an issue that you cannot manage, I want you to feel comfortable moving up the ladder. So first of all, you're going to look on your Cisco. You're going to look for the nurses in ready or in not ready. If everybody's in not ready, you're going to look for the care navigation nurse team lead. Maybe they're in not ready too. Then you have to look outside of care navigation. That's where you will be provided a list of everyone who is working that day with their telephone numbers. You will call the nurses that you know probably are not on a visit. Call them first and let them know you have a caller on the other line who needs help. Give them their name, details, be right to the point, get the caller connected efficiently, safely, and calmly. If you can't get a field on-call RN, you're going to have to go up the ladder some more to the nurse practitioner or doctor on call. We're available to help. Then you call me, the director. I get involved. If for some reason you can't get me, you go to our Vice President of Care Navigation, Jim Rice. It's important that you feel comfortable being a care navigator, that you feel comfortable knowing your own emotions, that you keep yourself calm, and that you keep our callers calm, because they, as we said earlier, have enough to deal with. Our job as care navigators is to simply make it easy, improve the care of these patients, get them help. Thank you so much. Please reach out to me with any questions you have. You have a lot more to learn. This is a brief Care Navigator 101 session. I look forward to talking to you a lot. Thank you.